Hi, Assalamualaikum warahmatullahi wabarakatuh. Today we are from Group 1. We'll be presenting on transmission infection at workplace. We will briefly explain about the type of infection, the mechanism of infection, the risks and consequences of the infection, and how to control and how to prevent the infection. Healthcare-associated infection (HCI), or also known as nosocomial infection, is one of the most common complications of healthcare management. The infection not only can be acquired in hospital but also rehabilitation facility, diagnostic laboratory, or any other clinical setting. The nosocomial infection can infect the health workers and the patient, but among all the healthcare workers, doctors are reported to be highest to be prone to get infected. The transmission is varied, including contact, droplet, and airborne. Direct contact involves physical contact, and this usually revolves around the doctors and nurses, whereas indirect contact occurs when a person in contact with contaminated items or surfaces, and this usually revolves around person who is not directly dealing with patients.
Assalamualaikum warahmatullahi wabarakatuh. My name is Masyitoh Binti Nizamuddin, and I will talk about the type of infection, which are bacterial infection, viral infection, and fungal infection. First is the bacterial infection. Bacterial infection is caused by bacteria, a single-cell microorganism known as prokaryote. A bacterial infection is common and easy to catch at the hospital setting, as bacteria can infect any area of the body. Pneumonia, meningitis, and food poisoning are examples of illnesses that caused by harmful bacteria. However, the most common disease that infect patients in the hospital is pneumonia. Second is the viral infection. Viral infection also is one of the common infections that occur in hospital setting, and it is caused by virus. Viruses cause familiar infectious disease such as the common cold, flu, and warts. They also cause severe illnesses such as HIV, AIDS, smallpox, and Ebola. Mode of transmission of virus is vary for different types of virus. In hospital setting, healthcare workers are prone to get infected with HIV through needle pre-injury, as needle pre-injury is the most common injury that occurs among healthcare workers. The last one is the fungal infection. A fungal infection or mycosis is a skin disease that is caused by fungus. Fungal can cause skin infection at any part of human body, and example of common infection that caused by fungal are Aishah's foot, ringworm, chalk itch, and Ashley's infection.
Assalamualaikum. My name is Siti Aishah Binti Bakri. I will explain on the mechanism of transmitted infection. Hospital is one of the most hazardous zones that makes the transmission of any pathogen easily occur if there were not any precaution taken to prevent it. There are many ways pathogens like viruses and bacteria in hospitals can be transmitted. These mechanisms of transmission is direct contact, indirect contact, and needle pre-injury. The first mechanism is direct contact. Airborne pathogens can transmit through direct contact by droplet spread through a cough or a sneeze of the infected person that get transmitted through the air. However, this kind of transition requires close proximity due to the fact that the droplets tend to fall to the ground after a few feet. The transmission could also occur through the person-to-person contact that gets transmitted from the patient touching or exchanging body fluid with someone else. It can be transmitted from shaking hands and then touching the face, where the pathogen can enter through the nose and the mouth. These pathogens that are airborne are most likely to cause malaria, measles, and respiratory infection. Next is indirect contact. This mode of transmission happens when there is no connection between one person and another. Indirect contact can happen through many things, including airborne transmission. This happens because of some of the pathogens stay in the air for long times, causing any person who would inhale the contaminated air and infected, even if the person who spread it to the air was not in a close proximity. Pathogens can also spread indirectly due to contaminated surfaces. This is most common in healthcare services if the surfaces are not sterilized frequently, and the pathogens move from the contaminated surface to the skin of the infected, and it could either enter through an opening of the skin or through touching the eyes, mouth, and nose. Next is needle prick injuries, which occur the most common in healthcare facilities between phlebotomies. This kind of injury only transmit blood-borne pathogens like HIV and hepatitis B virus. The needle must be contaminated with the blood of an infected patient, otherwise it will be no harm. The awareness of this injury is enforced on every worker that deals with needles, and prevention steps also stated in the standard operating procedures. However, according to the World Health Organization, 2 million healthcare workers contracted infectious disease from needle stick injuries in 2002.
Hi, Assalamualaikum warahmatullahi wabarakatuh. I'm Nurul Shahida 1814778, and today I will discuss about the risks and consequences of transmission infection. So what is transmission infection? Transmission infection is the infection that has been transmitted to the healthcare worker in hospital through any types of infection mechanism. So in this part, I will focusing on several types of transmission infection, which are sharp injuries, ventilation system, and medical waste. So, sharp injuries. Sharp injuries are common, especially when we are dealing with sharp items such as syringe, scalpel, and many more. Healthcare workers can get sharp injuries from procedures such as drawing patient's blood, administering medication, disposing or recapping the used needles, and even when collecting trash and linens. So, the examples of transmission infection from sharp injuries are HCV, which is hepatitis C virus, HBV, hepatitis B virus, and HIV. So effects of sharp injuries are cost spent for the counseling, the blood test, and the treatment. So workers infected from sharp injuries are also eligible to get worker compensation benefit to ensure that they will get proper treatment. However, due to the long period of medical care, for example HIV, it can induce stress and fatigue in some individuals. Is ventilation system. It is believed that the air of the room is associated with the detection of pathogen and disease transmission. Thus, it is important for the workplace, especially hospital, to have a good ventilation system. There are 3 types of ventilation, which is natural ventilation, mechanical ventilation, and mixed ventilation. Natural ventilation is depending on the buoyancy force, where the external air entered the room through a window and going out back through the window. And fan is one of the natural ventilation example. Mechanical ventilation, however, is a built-in ventilation system that involves plant and engineer specialists to build the system. It is an expensive type of ventilation but very effective. Lastly, mixed ventilation. It is the mix between natural and mechanical ventilation, and this is the type of ventilation applied by most hospitals nowadays. What is the result or effects of the poor ventilation system? So, poor ventilation system could lead to circulation of airborne disease in the room and can infect the health workers. Examples of diseases that can be spread through airborne are influenza, measles, pertussis, and varicella zoster. As a result, the affected section will be closed temporarily, and this will affect the workflow of the hospital. The medical waste. Medical waste is categorized by Environment Protection Agency as potentially infectious waste, which is PIW, and this waste is usually generated by medical doctors, hospitals, clinics, and doctors' office. The medical waste includes microbiology stock and culture, blood and blood products, sharps, contaminated laboratory waste, surgery and autopsy waste, and dialysis waste. However, there is no epidemiologic evidences show the transmission of disease due to improper disposal of waste, excluding the sharps. Because sharp injuries while handling hospital waste show significant increase every year, and the affected workers need to report the incident to the authorities for further screening and treatment.
I'm Illy Zahzlin with Zainal 1812282 will explain about principle of infection control and prevention in universal precaution. Next, personal protective equipment PPE. There are gloves, gown, mask, respiratories, eyewear. The usage of all the items above are to create barriers that protect individuals, mainly healthcare workers, from infectious agents when dealing with patient or specimen. Glove is worn when performing procedures that involve blood, body fluid, non-intact skin, and any practice that involves vascular access. Surgical mask, goggle, and face shield is used to prevent the chance in getting contact with splash of blood or body fluid to the face area. This implies to both workers and patients. In order to prevent respiratory disease transmission, several acts of coughing or sneezing must be obeyed. For instance, nose or mouth must be covered with a tissue while sneezing or coughing before being discarded in the nearest waste bin, and hygiene should be immediately performed. Needle stick and sharp injury prevention.
Prevented from exposure to bloodborne pathogen while handling needles and other sharp devices.
Next, waste disposal. Different types of waste in hospital must be addressed accordingly. In such, sharp items must be disposed in leak-proof puncture-resistant container. Then, non-sharp disposal items that contain blood or body fluid are guided to be disposal in biohazard bags. Safe injection practice. This applies to the workers who involve in injection procedure to the patients. Every time an injection must be done, new needle and syringe must be used.
I am Nurul, Syifa, Nasuha, Binti, Jamaludin, and I will talk on the second principle of infection control and prevention, which is transmission-based precaution. Transmission-based precaution is implemented in addition to standard precaution to prevent the transmission of infectious disease agent, especially the emerging agent from a patient to other people. There are three categories of transmission-based precaution. It has been categorized according to the route of transmission of the infectious agents. The categories are contact precaution, droplet precaution, and airborne precaution. Contact precaution is implemented to prevent the transmission of the microorganism through direct or indirect contact from patient to the other people. Next is droplet precaution. This precaution is aimed to prevent the transmission of the infectious disease agent from the respiratory organ secretion of the patient. The agent can be transmitted through coughing, sneezing, and even talking. Next is airborne precaution. These precautions are needed if the patient is infected with microorganisms which remain infectious when in air. This table shows the precaution steps for contact, droplet, and airborne. Isolation of patient in a single room is need to be done for each category. However, for the airborne precaution, it is advised that the patient need to be isolated in an airborne infection isolation room. Next, health practitioners need to wear proper PPE when handling the patient. The use of N95 mask or higher level of respirator is recommended in airborne precaution. Third, the patient movement need to be restricted. The patient is required to wear mask in droplet and airborne precaution. And special ventilation room is needed in airborne precaution as the agent remains infectious for long distance. In conclusion, healthcare worker is an essential worker that highly exposed to transmission infection in the workplace. Transmission infection toward healthcare providers can be reduced by wearing the proper PPE and follow the provided prevention steps during working, such as standard operation procedure to ensure the safety of the healthcare worker and their family. With that, that's all from us. Thank you for watching.